1 in 4 residents of Baltimore City live in areas classified as food deserts.
Yeah, I live in Hollis Market. So I live maybe 6-7 blocks away.
Okay.
And this neighborhood used to be a food desert, not too long ago.
Okay.
So now we have a price rise. Of course, we had a market, but still, organic, fresh produce is difficult to come by at affordable price. And so this market allows us, this little community market allows us to be able to get fresh produce at a reasonable price. So I come here every Monday.
According to the 2015 Baltimore City Food Environment Report, Southwest Baltimore has been classified as a food desert. Hello, we are the University of Maryland, Baltimore SNPhA chapter, and this is our Prescription for Service project. We are here to show you how our team, RxProduce, will be connecting the pieces between Southwest Baltimore and the surrounding community. For decades, Southwest Baltimore has been plagued with violence, poverty, unemployment, and illicit drug use. RxProduce aims to relieve part of this burden by transforming this food desert into a healthy eating community, using reclaimed lots as resources to help decrease crime, violence, and illicit activities, encouraging quick and easy access to fresh produce in Southwest Baltimore as a means to increasing the current low life expectancy, and creating an economically stable and sustainable community.
Our goal is to work on sustainable ways to fight the food desert in Southwest Baltimore and create access to healthy, affordable fruits and vegetables for individuals in the community through the University of Maryland Community Engagement Center. More specifically, RxProduce will sponsor public and private beds at Pop Farm. Pop Farm is a community garden that provides the local residents with soil, seeds, plants, water, and tools needed to grow fresh produce for their family for free. The public beds will be adopted by the community where they can plant and harvest the produce they need. The private beds, sponsored by Prescription for Service, will be adopted by the Community Engagement Center, which will provide volunteers to work and maintain them.
RxProduce aims to collaborate with Producing a SNAP, a program sponsored by Hungry Harvest, whose mission aims to ensure food access is a right, not a privilege. Produce in a SNAP is a reduced-cost community market supported by Hungry Harvest subscribers and private community funding. They collect food donated by grocery stores and farmers and make them available to the Southwest Baltimore community at reduced prices of $7 a bag.
This year, SNPhA aims to close the gap by connecting the pieces. And through the Prescription for Service competition, RxProduce aspires to make this connection as follows. Patients. Our patients are the undeserved community members of the Southwest Baltimore region, from young to old and all in between. Inclusion. Local community members are invited to adopt and cultivate SNPhA-sponsored bed at Pop Farm. People from all walks of life, including elementary and middle school children, and senior residents from Hollins and Poppleton houses, who make up over 50% of the Pop Farm's gardeners. Empowerment. It goes without saying, if you give a man a fish, he'll be fed for a day. Teach a man to fish, and he'll be fed forever. Project RxProduce strives to equip and empower the local community with the skills and education needed to help fight the battle against food deserts by producing their own fresh fruits and vegetables at low or no financial cost and ultimately increasing food security.
Community. These are our neighbors in Southwest Baltimore and beyond. Education. RxProduce will work together with Producing a SNAP and the University of Maryland Medical Center to offer a variety of health information on HIV, hepatitis C, hypertension, diabetes management, and more. Healthy eating recipes will also be provided through the University of Maryland Medical Center Healthy Men's Program, which caters to men with hypertension. Service. SNPhA members will serve as volunteers to the surrounding underserved community through the provision of preventive health screenings, point-of-care testing, and health education.
$2,500 will be an instrumental piece of making the Team RxProduce dream a reality. Here's how we plan to utilize the funds provided through the Walmart Prescription for Service grants. Overall, RxProduce will connect the pieces in Southwest Baltimore to provide a sustainable program for our community to save money and live better, healthier lives.